Marcelo, thank you for joining us, and please, this.
Gabriel, many thanks, and in particular thanks to the WHO and PAS for the opportunity of presenting today. Next slide, please. So what's the vision and the mission of the TTS? TTS is an NGO of the WHO. The TTS will provide the focus for global leadership in transplantation, the development of the science and clinical practice, continuing education, scientific communication, and guidance on ethical practice. Next slide, please. So what would be the main roles of the TTS? Education of transplant health care professionals, standardized practice and advise governments, and dissemination of the information. The TTS has been heavily involved with, for instance, the Sisters program in combination with the ISN. Next slide, please. I would like to focus on the role of the TTS following the Pontifical Academy of Sciences and the WHO workshop. We would like to promote the objectives of this workshop, request governments, national agencies, and ministries of health to address the burden of diseases resulting in organ failure requiring organ transplantation, the need to prioritize organ transplantation as a healthcare treatment option for patients with organ failure by considering technical aspects to develop and optimize organ transplantation and strengthening the regulatory capacity for oversight of practice. Next slide, please. In the absence of international standards for patients' suitability to undergo organ transplantation, we would like to propose to standardize criteria, such as to list patients for organ transplant from deceased donors. And you can see at the bottom the links to recommendations and guidelines from the Canadian Society of Transplantation, as an example, derived from the kidney, the liver, and the heart transplant groups. There are for all organs. Also to select donors and recipients for living donor transplantation. We would like to promote educational events to standardize listing criteria for organ transplantation and to implement such standards with the help of regional TTS champions. Next slide, please. Next slide. So we would also like to urge member states, stakeholders responsible for organ donation and transplantation policy to assess criteria for the allocation of organs from deceased donors, to enable patients with organ failure to have access to organ transplantation from deceased donors standardized by medical criteria. Next slide, please. As an NGO of the WHO, TTS requests to address this issue in a WHO global consultation. We would like to propose to promote standards of practices to optimize organ transplantation as a treatment of choice for patients with organ failure. The access to organ transplantation from deceased donors should be based on medical criteria with no advantage by gender, ethnicity, or social status. Next slide, please. And as discussed by this committee at a previous meeting, it would be important to develop report cards using data available through the ONT and the Global Observatory on Donation and Transplantation. This would be a very interesting project. Next slide, please. This is a slide that was created by my wife, Andy, where you can see the relationship between meetings and the level of enthusiasm or engagement, a word that I prefer to use for this workshop. On the graph, you can see up to, on a scale, an empiric scale of 10 as a max. In blue, you can see the level of enthusiasm. So we have a meeting like today, and the level of enthusiasm and engagement is high. But then let's imagine that we were meeting in Rome at the Vatican. Then we would go back home, and the level of enthusiasm and perhaps engagement would decrease, as you can see, from 10 to 6 and then to 4. So we need to close the gap. We need to close the gap to keep a high level of enthusiasm and engagement, more meetings, more discussions. Next slide, please. With the goal of increasing access to transplantation worldwide. Next slide, please. I would like to acknowledge the TTS International Headquarters, the TTS committees, the TTS Council, the Executive Committee, and past TTS presidents, Nancy Asher and Frank Delmonico, for very valuable discussions for the preparation of this presentation. And of course, my wife, Andy, who supports me every day. Thank you very much, and I will be happy to answer questions when the time comes.
Thank you.